Hi, this is Dr. Apurv Mehra.
Hi guys, this is Dr. Dilip.
Okay, so welcome to Cerebellum.
Welcome to Cerebellum.
Sir, how do we speak welcome to Cerebellum in Tamil?
Vanakkam.
Vanakkam.
Sir, what minute, sir?
No, but you have to tell me about Cerebellum, how to speak Cerebellum, because that's the point where you are talking on the channel
So
of Cerebellum.
you want the Cerebellum in Tamil?
Yes. Sir, you did not come prepared. Look, this is not my idea. The original idea could have only come from the universe boss, as we call him, Dr. Praveen Tripathi. So I am just copying his idea, and this is what he told me to do, right? So my point is, sir, when I was an MBBS, I started studying from Harrison.
Okay.
When half of the year was gone, I shifted to Davidson. When 2 months were left, I shifted to a Kunji. And when I was writing my exam, I was looking at the paper ahead. All right. So medicine is one such subject in your hands. All right. So, and I believe that even if somebody starts on January 1st and wants to finish off medicine by 31st December, the whole year will be less.
Yes.
So, can you have a middle path regimen for medicine for the students who are going to be with us on Cerebellum, so that they have something practical, reasonable, so that they can complete and achieve about 80 to 90% of questions in the exam? That should be a good score.
Good score, yes, sir. So I would say like still the short subjects are kind of powerhouse. The sense like you can get 100% in most of the short subjects, but medicine is not such kind of a subject which is going to yield you 100% all the time. I have to be frank. So because examiner can ask questions from anywhere, but there are some areas that are going to be very, very important for exams. So if you're going to crack those areas, you're going to definitely score more than 90%, which is actually kind of a terrific score. If they can score more than 90% in even an overall 200 questions, that's going to be a terrific score. So that is what the entire idea is. So we're not going to talk about those 5-10% of that, which is something that may or may not come in exam. But those 90% that are going to be repeatedly coming in each and every exam is what is going to be the most important. And we're going to target those areas only. And students will understand. So I will say like the one-stop solution as of now, this is not kind of boasting, or this is not to basically like say you come to Cerebellum. But the kind of effort that we are making, to translate that into content that is most relevant and revisable for the students, based on that, I'm saying that definitely once they come to Cerebellum, they will 100% understand like what is like really what we are trying to do actually here.
Right. So if I look into, I have been closely watching the behind the creation of Cerebellum lectures, and one of the person whom I really idolize the way he teaches is Dr. Gobind. And when you look at him, what he does is, he'll always, in every meeting we'll have together, he will always brainstorm us that what you don't have to teach, right, that should be taken out. A good teacher should know what not to teach. It is very important. So he says the classical thing that is forming the basis of Cerebellum is, first of all, focus on the topics which I've been covering. And he'll give an example. When he gave an exam, when I gave an exam, when he gave an exam, the topics were still the same. When you will give the exam, they will still the same.
Yes.
So to keep us on target, there is something called as previous year questions, or PYQs. I think if you revolve around the options of it, and if you revolve around the topics there, and you summarize with the experience of the teachers,
yes,
I think that should be good enough.
That should be good enough, sir.
Yeah.
Most of the times the PYQs are going to form the base, and what topics they are asking. Most of the times we know that the direct question repeat may not be there, but topic repeats is going to be there. So I tell the students the same strategy only. Once an examiner sets a PYQ, it's not like that he has set only one question from the topic. You would have taken multiple questions from the topic, which may be repeating in the next coming years. We don't know that. So obviously, like even if I am an examiner, I want to create a question. Suddenly NBA asks me to do it. So what I will do, I'll go to the previous year questions and to understand what is asked. And based on that, I may not be asking the same question, but I will set a new question from that same topic because I got an idea probably this is what is more important.
Right.
So that is the reason why understanding the previous year topics, and as you rightly said, the options around it is very important, and it's better to create content around it. So when I am creating any content, So what I do is I think from students' perspective. So if I am going to write exam tomorrow, what are the most important topics that I should read? And if I want to score rank 1, what are the topics I should read in medicine? If I am in a time crunch,
Right.
just 30 days I'm having, I want to finish medicine, what are the topics I will read as a student? So those topics only we are going to do. That is going to be the most important topics, and after that, whatever I feel that examiner may ask, that we will be adding upon.
Yeah. And one more thing I want to tell you, right, which I can actually echo with sir. Sir is into active practice. I am into active practice. In a clinical subject, whatever you will see in the OPD, you will see in the MCQ. It's a rule. The ratio of distribution of questions is absolutely same as the ratio of distribution of the patients in the OPD and IPD. So you need to have a seasoned teacher and a seasoned practitioner to apply this basic science to filter out things. Right, sir?
Absolutely, sir. 100% true. What I was about to tell you, completed it. So apart from the previous year questions that we are seeing, being a clinical teacher, if I am going to like see some case today, so which is walking in my OPD, when I want to set question, my first thought will be on that case.
Right.
Obviously, I want to ask questions from that case. Then I may go to Harrison or some textbook and set questions based on that. So ultimately, what they are going to get is like what you said, the OPD cases and what common IP cases.
Right.
Still, that is the rule. 80% plus questions will be from common cases.
Right.
That's it.
And there comes the experience of a clinician in the clinical subjects, which is going to ace you up. I have some important things which the team Cerebellum wants to ask, sir. Sir, which is your favorite food item?
My favorite food item is anything that is relevant to non-vegetarian.
Okay, so you are a vegetarian?
I am a non-vegetarian, sir.
You are a pure non-vegetarian?
Pure non-vegetarian.
Okay,
sir.
so we'll take care of this. This when we go for dinner, Goga Bhai, that we take him to a place where there is pure non-vegetarian. Which is your favorite drink?
My favorite drink is virgin mojito, sir.
Okay, and Dr. Goga Bhai's is tea and mine is milk. So I take milk. So that is our favorite drink. Which is your favorite medical book?
My favorite medical book, I should not lie that I like Harrison.
Alright, fantastic. But which is your favorite medical book?
My favorite medical book is something called as Con's Current Therapy.
Okay.
So that is my favorite medical book because, basically I don't like Harrison.
Alright. So, which is your favorite non-medical book?
Favorite non-medical book is, it's related to astronomy.
Okay.
It is because I am a big fan of astronomy basically. So there is a book called Everything About Universe.
Alright.
So that is my favorite book. So I read very limited novels. So and in that novels I like a book called Seventh Secret.
Alright.
Which is about Adolf Hitler.
Fantastic. Which is your favorite sports?
Obviously, sir. I was an ex-cricket player. So definitely I like cricket. I should not say in front of Goga Bhai.
Agreed.
Obviously.
Agreed.
But hopefully I can say that I am a bowling all-rounder.
Fantastic.
So,
I'm going to show the pic of you balancing on the bicycle here. What make you do things like this?
so that's it. Basically, I was more interested in sports because I was very weak in studies during my school days. So I was not good at studies at all. So I should have an alternative career.
So you could balance yourself on the bicycle.
Yeah, I should. I tried some 2-3 stuff which I thought like maybe helping in my future.
Right.
So one such thing is like to do this kind of gymnastic activities.
Fantastic.
Like so, if this is not my profession, I would have ended up probably in cricket. But unfortunately, I couldn't do that because I should say it to you, sir, because you are an orthopedician. So I had a condition called patella alta. So that resulted in recurrent patellar dislocation. So I couldn't continue with the sports. But I was very scared because I know I am very poor in studies. So definitely I should have an alternative career.
But please do not copy him standing on the bicycle like this. So this is going to be a problem for you. The students want to know, how can you rotate a math book on your finger to get the balance right?
Sir, again, that's why. So these are the funny sort of things that we do because I used to play a lot of sport. So not just cricket. Cricket is very close to my heart. So I played cricket at a state level basically. And after that, the second sport I like the most is table tennis.
Fantastic.
I mean, not so good. Like people, if I say good, it will be bad. So it's okay. I'm an average table tennis player. And along with that, I used to play a good amount of football and volleyball also. So during those days, to impress people around.
Okay. So we have cricket, we have rotating the MacBook, we have standing on the bicycle, we have football, we have table tennis.
Sir, actually, what is the point in knowing things when you're not good in anything?
No, you are. Please again, do not copy standing on the bicycle, because if you do not get the balance right, it's going to be problematic. This is Dr. Apurv Mehra signing off from this Candid talk with the Dr. Dilip Kumar Ravi Kumar from Chennai. He is going to teach medicine, and it's going to be like beautiful. It's going to be like hand in glove with you. In the exam, you'll remember his voice and his face, and I'm sure you're not going to score 90%, you're going to score 100%. And remember that he is going to present it right to you at your home anywhere. Thank you very much.
Thank you very much, sir. Thank you.